Yes, welcome everyone. Today's topic, we did not finish what we started yesterday. We have the management of dementia. Dorothy, you can control your noise huko nje. Dementia, and I remember we stopped on alcohol and dementia with how alcohol can cause dementia. So I think we'll start by explaining how alcohol can cause dementia because uh, people need to understand alcohol is something that is abused, and sometimes people don't want to listen when they're told alcohol is not good. So uh, we will start by that. Just a minute. Yes, that is it. That is it. Now, what is alcohol-related dementia? Mumba, welcome. See, you've been waiting. We will continue with where we stopped yesterday. We did not finish all the types of dementia, the 10 types of dementia. And we need to remind ourselves the 10 types of dementia, including the ones we discussed about Alzheimer's disease and others. Mhm. So, what are the 10 types of dementia that we discussed about yesterday? Before we go to the before we go to the real deal, which is alcohol related dementia. Carole West, welcome. Welcome to the platform. I'm want to go through alcohol related dementia because many people take alcohol and they start having problems at old age and they don't relate it to alcohol. Alcohol is a substance that is really abused. So the 10 types of dementia is one here is Alzheimer's. We talked about Alzheimer's. You remember the amyloid plaque and tau proteins that form in your brain, that is Alzheimer's. Vascular dementia. We said when you hear about vascular, you think about blood vessels. Blood vessels, veins are that one. And Lewy body dementia, same as the Alzheimer's, but here we have the alpha sinulis Lewy bodies. They are kind of like protein deposits. The fourth one is frontal temporal dementia. Frontal temporal dementia. We have Parkinson's disease dementia. You remember about Parkinson's, the protein that forms in your in your brain and it causes Parkinson's. Yes, we discussed about it yesterday. We talked about mixed and we said there are four. You go and look at them, very important. And then we talked about Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease. You remember that? Creutzfeldt-Jakob disease is a disease that comes with poison. You see, I heard someone saying mad cow's disease. You see, and then we went to Huntington's disease. We went to normal hydrocephalus disease. That is nine, and then we went to the last one, which I said I'll start it today, which is alcohol-related dementia. And what is alcohol-related dementia? If you are asked, what is alcohol related dementia? If you are watching, you can like the video as we proceed. At least we create the chance of impressions by liking the video. And if you have a question, you can ask. You ask so that we be online. I usually say your question can help someone else. Even if you feel that question is so stupid, there is no stupid question. You just ask. Now, alcohol-related dementia is also called Kasok's syndrome. Kasok's syndrome. You see, it is caused by long-term alcohol abuse. Long-term alcohol abuse. And what does it cause? It causes thiamine deficiency. Thiamine deficiency. If you take alcohol for so long, what happens is you will have deficiency of vitamin B1. So vitamin B1 is the one which I'm calling thiamine. You see that? So this is how alcohol dementia comes out. Alcohol-related dementia is a cognitive impaired caused by excessive alcohol consumption, often seen in people who have abused alcohol for so many years. It includes both structural brain damage, because if there is no vitamin B1, which is thiamine, to help the brain grow, the brain starts to reduce in size or to damage. And other deficiencies, we are so many. You see, when we talk about vitamins are cofactors. They help your body to bond with several things so that you can be healthy. When you have bleeding from your mouth, what do you lack? You lack vitamin, because it's a cofactor that binds the protein layers so that you have a tough skin so that you cannot bleed. You see here, but now you have put yourself in taking alcohol for so long, a chronic alcohol users, and then you start bleeding from your mouth, brain atrophies. You see, vitamin B1 is the main cause. And how does it happen? Direct neurotoxicity of alcohol. When you take alcohol directly, it causes toxicity to your brain. You see, alcohol has a substance called ethanol, and it's a metabolite. Metabolite like acetaldehyde. When I say a metabolite, it it destroys some features or separates, damages neurons, especially in the frontal lobe of the cerebrum and the limbic system down the mid of the brain. You see, that's why when you take alcohol, some people have some short-term loss of memories. You get it? It destroys some neurons. The neurons. You remember yesterday when I was holding my hand like this and doing this and doing this. These are neurons, and they die. So the impairment causes neurotransmitter not to pass signals. You get it? Then it leads to brain atrophy. I've talked about brain atrophy for so long. Your brain starts to be small, especially the white matter. There is a part of the brain which is called the white matter and the frontal cortex, which is responsible for judgment, planning, and memory. So when you hear me saying alcohol is not good, you see, it destroys your judgment, planning, and memory by interfering with your prefrontal cortex just before the frontal cortex, where your cognitive functions of the brain are being undertaken. Now, second one, this is how the alcohol destroys your brain so that you can come out with the dementia. The second one is this: thiamine B1, vitamin B1 deficiency. Alcohol interferes with thiamine absorption. So when you are taking fruits, vegetables, you don't absorb vitamin B1. And you see, storage in the liver is destroyed. and even utilization of the vitamin B1 is destroyed. So, thiamine is essential for glucose metabolism in neurons. It helps the neurons to metabolize glucose so that they can have energy and good nutrients. So, if you cannot absorb any nutrients, what next? The neurons die. This means your brain becomes dysfunctional. Neuron death. This one is called Wernicke's encephalopathy. Encephalopathy is destruction of your brain. It's a very big word, but it just means your brain damage. Brain damages. You get it? It can be acute or reversible. And if it is not treated, you will have problems. It will have problems. Eh? It will lead to something called Korsakoff syndrome, chronic irreversible amnesia. Korsakoff syndrome, you always have chronic amnesia, dementia, forgetting every time. The third way alcohol can can make you have dementia is having vascular damage and hypoxia. I said hypoxia is not a big word. It just means lack of oxygen. Vascular damage. Imagine you lose oxygen, your muscles and tissues die because you have been a chronic smoker. You get it? Welcome, Doreen Small from Jamaica. Yes, I can see. Happy Emancipation Day from Jamaica. Welcome, welcome. Happy to everyone in the platform. Welcome. Good. We are talking how alcohol can destroy your neurons. Now we come here and say alcohol cause hypotension, low blood pressure is a hypotension, arrhythmias, your heart beating irregularly, either faster or slower, coagulopathies. Eh? When we say coagulopathies, it means blood clotting, issues with blood clots, which may contribute to vascular damage and increase in vascular dementia. So we are talking about the brain. So imagine having clots in your brain because of chronic usage of alcohol. You see, Emancipation Day. Yes, 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 yes. I'm seeing everyone is being. Yes, yes. Jean, welcome to the platform. Yes, yes. People are excited about the Emancipation Day. Big up all the crew from Jamaica. Big up all the crew from USA, Jean, Kenya, everywhere. Whoever is in Australia, we love you all. I know I'm talking to so many people. If I don't mention your name, big up, big up, big up, big up. Enjoy this day and make sure you go out today with positive vibes. Yes, 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 yes. We are talking about how alcohol can destroy your your brain. So the first one you said is direct neurotoxicity. It destroys your brain directly, the neurons of your brain. Second, it interferes with the absorption of thiamine, hmm, storage in the liver, and utilization. And you see, thiamine is essential for glucose metabolism. Thiamine is vitamin B1. One. You see, vitamin B1. The third one is vascular damage and hypoxia. It makes you not to absorb oxygen better to go to your brain. So your neurons die, and it makes you be at risk of having coagulopathies. Coagulopathies are diseases of blood clots. Good. Liver diseases and toxicity is the fourth one. If you drink alcohol so much, what will happen? Chronic alcohol use may cause hepatic encephalopathy, where the liver fails to remove toxins like ammonia, which then affects the brain. So if your liver cannot excrete ammonia, you see your blood will be with a lot of ammonia. So what will it do? It will go to the limbic system. And if the limbic system, the pH is changed, cognitive issues come in. Frontal cortex is destroyed, your judgment is impaired. And that's why you always see when a person is drunk, judgment is impaired. Driving is risky. Walking towards home on a heavy traffic is risky. You may get an accident. So we continue like you see Brain's region affected by alcohol, frontal lobe, where your impaired judgment, problem solving, and planning is not there. Temporal lobes, memory impairment. Temporal, we say this sideways. Cerebral, cerebellum, poor coordination and balance. Cerebellum is middle, so it's between the ears, and you will not have coordination and balance. Mammillary bodies and thalamus. You see, if your thalamus is destroyed, you become dehydrated. Your sugars will do what? Will go up. So you've seen some people when they take alcohol, they get dehydrated, their sugars go up. Now you know why. It's because the mammillary bodies and thalamus of the brain is destroyed in function, and you are dehydrated and your sugars are not absorbed well. Why? Because vitamin B1 is not doing its work in the liver. So you become hyperglycemic. You become with high glucose level. So don't ask why when a person comes to hospital when he's drunk, and then we do what? We no, sorry, it becomes hypo your sugars, you see. So these are the things that make you come to hospital. When you are drunk, the first thing we do what? We give you a drip of sodium chloride to rehydrate you. Clinical presentation of a person who has this problem of alcohol dementia, impaired memory and learning, difficulty with excessive function, disorientation, apathy, and emotional blunting. Age, poor coordination and balance. And we always say alcohol is fine, my friends. Just look the problems that alcohol is bringing us. Hmm? Confabulation, making stories to fill memory gaps. You cannot complete a story because you have forgotten the story and you're coming up with another thing to complete. And you see, when this happens, this is what we call common in Korsakoff syndrome. It's common in this syndrome of alcohol. So, what do we do to this person when they come to hospital or at home? History of long time alcohol usage is important. Exclusion of causes of dementia, the 9 cases that we talked about. Brain imaging may show cortical atrophies. Cortical, if we put you on an MRI machine or a CT scan, we will see cortical atrophies. Cortical atrophies means some parts of your brain are smaller. Some parts. You remember the foldings that we called the gyrias of the brain? You will find some of them are smaller than the others. You get it? Especially in frontal lobe and let me see. Let me see this one. This one is yes, yes, yes. Sorry about that. Especially in the frontal lobes here. Hmm? Thiamine levels may be low. Any person who takes alcohol, you see, most of the time we put them on vitamin B complex or thiamine to help the brain grow again. But you see, it takes time to grow again. So what do we do to these people? Neurophysiological testing to check the brain if it is functioning. So management, immediate thiamine supplementation. If someone is chronic on alcohol, I know we all have family members and friends that drink alcohol and you feel bad to them. Help these people when you come and find that they are starting to forget every time. They forget everything. You call them, sometimes they forget even your name. They forget car keys. They forget keys on the door when they are going out. If you find out this, or you ask them a question and they tell you, I will tell you when I remember. What is the first step? Immediate thiamine supplementation, preferable intravenous, or if there is no intravenous, you get oral. Hmm? You give them vitamin B1. That is what is called thiamine B1, so that they can be okay. They start creating memory by helping the brain get enough glucose and enough what? Oxygen. Thiamine it carries it helps glucose to be carried through your brain. So it gets oxygen. You get it? Very important topic, because I know someone out there is suffering and feeling bad because of someone who is over drinking. Now, this is good information. Hmm? Alcohol abstinence. Now, this is where the problem is. Let's talk about alcohol abstinence. The people that say, I cannot stop alcohol, I'm addicted, what do you think they have? Is addiction by choice or by force? Personally, I've looked at several people on addiction of alcohol, and what I can say, sorry if you are one of them here, because alcohol does not choose an intellect, a stray one, a person in the middle class, or where. All of us are doomed in this problem of alcohol. All of us. And you may find a professor who is an alcoholic. You may find a teacher who is an alcoholic, and you may find a house girl, a houseboy, or a gardener who is an alcoholic. What are you? I found out under my research, and very many research and modes I've done, is that addiction comes after someone is hiding behind something. You take alcohol so that people can say you are an alcoholic, but you are hiding behind something to cover something that is disturbing you. So when you get someone is an alcoholic, and then you tell this person abstain from alcohol, are you helping? To be sincere, I feel if I'm contrary to what I'm saying, please raise it. This is a free platform of discussion of matters mental health. So if you do your research, any person who says is an alcoholic, listen clearly. You'll find that this person has something behind that makes him drink like that. Alcohol is a bad substance. No one likes to be an alcoholic. It is a substance that people hide behind to cover something. If you are coming in, please, you can like, subscribe, and share so that we help some people. You see, when you like, it makes impressions, and someone may learn this information and it may help everywhere place they are. No, let's talk about that. If you find someone is an alcoholic, dig deep, find out what this person is hiding behind, help that person by solving that thing. Let this person come out of that thing, even if it is not stopping or abstaining alcohol, this person will reduce. Because when you're hiding behind something, or you're taking alcohol, showing people you are a drunken master, and there is something that is hitting you hard so that you don't want people to ask, you will take alcohol for long, and the damages that alcohol bring that I've said will make you be like addicted, because you will need the alcohol to do what? To get away with the pain that you are feeling. Imagine neurons that are destroyed because of chronic alcoholism. You will start shaking like this, shaking. Why? Because you yourself, the dendrites. Let me tell you the pathophysiology, how the shaking comes in. The shaking comes in like this. I will repeat how I repeated. This is a nerve. Just imagine a situation whereby this is a nerve, and these are called the dendrites, the fingers of the nerve. A nerve has fingers like structures, and this is a nerve, and this one is a finger like structure. So when an impulse is sent, it is brought, there is a neurotransmitter called acetylcholine at the end of these finger like structures. They should bond, so that when a certain amount of acetylcholine is sent, because this is a signal, it is received by this one. Send, it is received. Send it. So when I pinch you, it sends and it receives. It tells your brain that someone has pinched you. Then it goes back. So when you have taken alcohol, and let me say, these have died, and they are remaining like this. So when an impulse is sent, One of it is sending, here it's not being received. It is sending, here it is not being received. It is sending, it is received. It is sending, it is not being received. The problem comes here. When it is sending, it's not being received, that is where you feel someone doing what? Shaking. But when you take alcohol, it destroys, it impairs your nervous system, then you are calm. You have not taken care of the damage. You have blocked the nervous system. So if you have blocked the nervous system, what will happen? The sending and receiving reduces. So you think that you have dealt with the problem. You have not dealt with the problem. You have just destroyed your nervous system not to function well so that you can be comfortable. You get it? And by that is what we call chronic use of alcohol. And when it is chronic use of alcohol, people say you are addicted. You are covering a symptom by a disaster. You get it? I wish if a person is an alcoholic out there, share this video or bring that person to this platform. We assist. You see, you say, I'm waking up in the morning going to find alcohol so that I can be stable. It is not that way. You are destroying your nervous system so that you can go on to be stable, not to shake or to feel the symptoms. And you remember, when you take the alcohol, thiamine is being destroyed. Your brain cannot get oxygen because thiamine helps your brain get oxygen and nutrients. So, brain damage. And then if it's brain damage, the liver does not uptake, the liver does not uptake enough oxygen. What happens? Liver cells die. If liver cells die, what happens? You start having yellow eyes. You start having high ammonia. Ammonia in your brain, in the limbic system, causes what? Encephalopathy, brain damage. You see how alcohol works. You may take today and feel the effect. If you stop, it will be reversible. But chronic one cannot be reversible. You destroy yourself for so long. This is the how alcohol destroys people out there, my people. Now, this is just a topic on mental health. This is a topic on mental and physical health. Physical health that helps people out there. You get it? So don't stay with this information. Help someone, help someone who is out there who don't know, who doesn't have the information. A person who has always wanted to know, why am I shaking when I've not taken alcohol? Bring that person here, we help that person. This is a platform where we help. Remember? Now, we continue very good. Thiamine, in diagnosis, if you find that, you see thiamine levels may be low. Always, thiamine levels here are low. And you've seen, we have talked about the issues when it comes to how thiamine helps. Now, we go to management. We have said you you supplement with thiamine, oral or intravenous in hospital. Alcohol abstinence, we have talked about it, help that person to come over with, to get away with the problem that that person is having. Now, nutritional support, all the vitamins, vegetables and minerals. Where do we get vegetables and minerals? You see, sometimes someone may ask you, what is alcoholic nutrition? And then you say vegetables and minerals, because someone may be struggling with something and then this person does what? Comes out and says, now I want to leave alcohol. What is the nutrition in alcoholics? You will say decreased nutrients intake, because these people don't like eating. Poor absorption of nutrients, we have talked about it. Impaired nutrition metabolism. Nutrients loss, those ones we have talked about it. So there are some nutrients that I'll talk about, but I'll pass by. Uh, there are some nutrients that are lost in alcoholism. Thiamine is one. I've really talked about thiamine, guys. Please, thiamine. the main thing that causes brain damage when you take alcohol. Folate, anemia, fatigue, and irritability. You will know folate is not there. Vitamin B12, vitamin B, vitamin D, bone pain, and osteoporosis. Alcohol will make your bones be weak. Greetings, Lady M. I'm seeing you on the platform. Welcome to the platform. We're talking about alcohol and dementia, man. Alcohol and dementia. Now, protein levels, muscle wasting, poor immunity. Because now, if you don't have vitamin B1, which is thiamine, your immunity will be bad. Your immunity will destroy. So, let's continue. How can we help these people? Someone has come to you, has said, now I want to leave alcohol. Which foods can I eat so that I replenish thiamine, which is vitamin B1, to help my brain so that I cannot forget? Or that person who forgets easily. This is the nutrition. High protein, nutrients dense diet. Meat that does not have fats. You get it? Meat that does not have fat. If you have a question and you are confused, don't fail to ask. Please ask questions so that we be in the same line. Yes, Marlene Augustine. Yes, welcome to the platform. If you have an experience with a relative, with anyone you say yes, I like this. This is like Marlena said. Thank you for this important information, Dr. Benjamin. I'm humbled. I want to help everyone to know all this. We are talking about mental issues, how alcohol can destroy your brain. And we have said, so if you are coming in now, subscribe, share to other people. We need people to get this information. Very important, very important. Now, high protein and dense meat that is lean, does not have high cholesterol. Legumes and dairy and nuts, very important. Supplementation, always oral or intravenous. You give vitamin B1. We have said it's thiamine, vitamin B1. So if a person loves alcohol, you start having B1 on your side. Multivitamins, folate and B12 injections, so that they may help you absorb glucose in your brain, so that your brain cells does not die. For those people who love alcohol, hydration and electrolytes very important, so that you cannot be dehydrated and your sugars to go high. You see that? Very important. We all have some people out there, brothers and sisters, who are alcoholics, and we want to help them. Send them the link. Tell them, I know nowadays why you have these symptoms. Let me help you. Hydration, water. Sometimes people think when I talk about hydration, I'm really talking about water. When I'm talking of hydration, don't walk around with a bottle of water, plain water, saying I'm hydrating. Walk around with soups, things that have electrolytes, like sodium. Buy the ones that are artificial in the shops. If you can't cook at home and walk around with bone soup in that bottle you walk around with, the bottle. Buy them, put something in that water to hydrate yourself. Don't just take a plain water. Nutrients are important. Nutrients are very important. Hydration, supportive for liver health. Avoid processed fat and sugars. Avoid sugars. A lot of sugars will make you have high glycogen. High glycogen in your liver. What will it do? You will start having fatty liver. Fatty liver will lead you to have liver cirrhosis, which can be a form of cancer, my friend. You see how things, when you love something so much, balance it. Yeah, very important. Antioxidant rich fruits, rich foods like fruits and vegetables. That is the main. But you've seen the main thing when we talk about alcoholism, we have talked about vitamin B1, thiamine, which is a co-transporter of glucose to the brain so that the tissues may not die and get oxygen. And that one is where Now, alcohol comes in and destroys the transportation. You see, we have talked about it. Now, we have talked about alcohol very much. We have talked about alcohol. If you have someone who has these problems of alcoholism and you are confused of something, my platform is open. You you can ask that question. I will answer medically, and also socially, because social issues affect mental health. You get it? Now, we have talked about that. Now we talk about the the treatment of types of dementia. We are talking about today types of dementia and how they can be treated. And you, as you we talked about, we said dementia is a broad word under 10 subjects that I've named today. You get it? So we start by, let me see what we will start by. We will start by Alzheimer's disease. We start by Alzheimer's disease. You see, Alzheimer's disease, we have talked about it for so long, and we said it is accumulation of tau proteins and plaques in the brain. So it destroys your brain not to function well. So if it is accumulation, what can we do? How can we help a person with Alzheimer's disease? How can we help a person with Alzheimer's disease? How? And we said it's a it's progressive neurodegenerative disorder that causes memory loss, cognitive decline, and behavioral changes with no cure. Management focuses on slow progression, functioning, and supporting both the patient and the caregiver. So this is a very bad state because it has no cure. The only thing we can do it is to enhance slow progression, because when the protein come in, you cannot open the brain to remove them. So what do we do? Pharmacological management. When I'm talking about pharmacological management, I'm saying drugs, drug management. How can we help when it comes to drug management? When it comes to drug management, there are drugs called cholinesterase inhibitors. They boost neurotransmitters in the brain to improve memory and cognition. These drugs are like ristigimine, galactamine, and denovapine. Those are cholinesterase inhibitors. They enhance acetylcholine. They inhibit something called cholinesterase, which breaks down the acetylcholine. You see, and then we have NMDA receptor antagonist. They enhance, regulate glutamate to support memory learning. So NMDA, they enhance glutamate. Glutamate, you remember, the main issues here we are talking about neurotransmitters. So in your brain, if you are destroyed neurotransmitters, you will not have good good function. You get it? You will not have good function. So this is how we help with the drugs. And then behavioral and psychological symptoms. Depression. When a person has depression, you don't give antipsychotics. I talked to you about that, like olanzapine. If you give someone an olanzapine who has depression, you will worsen that person, my friend. You will worsen that person. So what do you give? You give sertraline and citalopram and citaralin. Why do you give these drugs? Hmm? You see, a person who is an alcoholic have said that, and this is the core thing that I'm repeating. You see, this person is under some depression. Even it, how happy that person looks, or how this person seems to be partying. Find out the happiness inside it. You will find there is something that is pushing this person to be always on alcohol. So what do? You give some antidepressants. There is no one who wants to be an alcoholic by choice. No. There is no one who likes to be branded an alcoholic name here. You see that? No one. So what do? You give antidepressants. Please don't give an psychotic to an alcoholic. You will be worsening. Some people confuse antipsychotics to antidepressants. If someone has anxiety, you give anxiolytics, like benzoxil. Yes, these drugs are controlled. I'm just enlightening anyone so that if you're not a medic there, you can at least have some knowledge. Agitation and aggression. Now, you will find some people, when they are alcoholics, they display moods of psychosis. Hmm? So what do? This is whereby you now introduce an antipsychotic and a cautious watch, like risperidone. You see, like risperidone with cautious due to stroke risk. Because a person who is having this alcoholic with depression, you give risperidone and a cautious watch, this person will get stroke. You get it? So you just don't walk in a drugstore and ask for these drugs. There's some people who like selling drugs without caution. They will sell it to you because they want to make money. In some states, it's controlled and it is really controlled. But in some states, there is no total control. So it is very important to know this knowledge. When I'm buying because I want this person to calm down, know that you can give that person stroke. Health is matter of being cautious. A simple thing can destroy someone forever. So don't just buy drugs. Seek assistance. Sleep disturbance. Melatonin, when it comes to sleep, it helps. Or sleep hygiene. Avoid benzodiazepines if you have sleep problem. Now, there are some problems that are non-pharmacological, like let me see, we have been managing Alzheimer's, and you see there are some people who have Alzheimer's disease secondary to alcoholism. Hmm? So I've been dealing with both of them. These drugs are helping Alzheimer's, but they can also help in alcoholism. Now we talk about behavioral and psychological symptoms. That one we have talked about: depression, anxiety, agitation, aggression, sleep disturbances. Now, without drugs, what can you do? Without drugs, what can you do in Alzheimer's? In Alzheimer's disease, cognitive stimulation important by giving some works to be done. Reminiscence therapy, having some therapies that will help this person. Music and art and pet therapy. Music is very important. Art is very important. When you are doing and thinking what to do next, it helps stimulate your brain. Reality orientation and validation therapy, very important, done by professionals. These are non-pharmacological. Hmm? Environmental modification. If you have ever had a person with Alzheimer's disease in your house, or you walked to a house where there is a person like this, you will see some areas are labeled, rooms are labeled. It's very important. Simplify daily routine. The daily routine are simplified and you train them, because this is a disease that we cannot treat. We are managing. At an early age, if it is managed, you can go well, for years. Ensure safety. Remove hazard, install handrails so that you cannot get trauma. Someone coming out from stairs, there is no rail, then this person falls because he's confused, not knowing where to go next. Nutritional management, you have said vitamin B is very important. B12 and folate is very important. Antioxidants like C and E. Vitamin C and E are antioxidants. So you give vegetables and some products that have this. And if you don't have them, You can buy syrups in hospitals or in drugstores. Omega-3 fat acids, omega-3. This one's fish head have omega-3. You can use it. Balanced brain health diet, e.g., Mediterranean or mild diet, very important. Ensure adequate intake of those things I've said. Omega-3 fatty acids, antioxidants, especially vitamin C and E, and B vitamins, especially B12 and folate. Manage hydration and prevent malnutrition. Prevent malnutrition. Daily functions and support. Help them. Help people who have Alzheimer's disease by taking them for occupational therapy. Occupational therapy is whereby you are helping this person to do something with his hands that can help him survive. Like you can take this person to a place where they weave clothes, they sew clothes. This one can help him because him or her, because it can be an income. That is what we call occupational therapy. But physiotherapy is a rehabilitation. You cannot walk well, you had a trauma, you had a fracture, and then you come out with physiotherapy. We are helping you to move normally, just like before the accident happens. But occupation, we are exploring you to help yourself to do something that is income generating. Those are the difference between occupational therapy and physiotherapy. Now, I know some people always are confused about these two words. Now, we continue with encourage physical activities like walking, stretching. It enhances absorption of B folate, vitamin B, promote social interactions and reduce isolation, because when you reduce isolation, memory deteriorates faster. Hmm? So if you this person is always isolated, the memory will go faster because you will not be reminding yourself of daily chores and every daily experiences. Structure daily routine to reduce confusion. You give a routine. If you wake up, brush your teeth, take tea, you do this like it is washing the house. You wash the house, then after washing the house, it's lunchtime, do this. You get it. Those are structured routine that can help. Caregiver support to advanced disease progression, it's very important. Support groups is very important. You get it. Those support groups is very important. Respect care to reduce caregiver burnout. You help not one person alone, help with several people. Regular monitoring and follow-up is very important. That is about Alzheimer's disease. If you have ever come across Alzheimer's disease, now you know it is a tau protein, new protein that grows in the brain, and it destroys the functions of the brain. So there is nothing, we cannot do surgery. You cannot open someone's brain to remove these proteins. So what do? We ensure good management. You get it? You ensure good management step by step and pray to God because God is our savior. Yes, your vascular dementia. Now, this is where we come. Vascular dementia. What do we talk about when we talk about vascular dementia? I said when you hear about vascular, what do you associate yourself with? You associate yourself with veins, arteries, lymphatic system, capillaries, and the brain. Vascular. Vascular means the vessels. Vascular means vessels. It's caused by reduced. Now, dementia here is caused by reduced blood flow to the brain. The brain has reduced blood flow, often due to stroke, small vessel disease, other vascular conditions. Management focuses on preventing damages, controlling symptoms. You see, now let's talk about the people who can get vascular dementia. The people who can get this, like people who have hypertension, diabetes mellitus, diabetes, yes, hyperlipidemia, high cholesterol levels. Smoking. Look, smoking is coming in again. Obesity and inactivity. Big bodies and you are not exercising. Arterial fibrillation or arrhythmias. So, how can hypertension cause? And you see, hypertension can rupture your blood vessels because when the heart is pumping, pa, pa, the pressure is so hard and your veins, they become big. It's like a balloon. Eh? Now the heart is the pump, like my mouth. This is the walls of the walls of the artery. That is how the heart pumps. And then the pressure is so high. So what happens until it bursts? Now, what happened next? No enough nutrition in your brain and no enough oxygen and blood supply. So your brain may die, some tissues may die. This is how hypertension comes. Diabetes mellitus, high sugar levels in your system may cause what? It may cause something called ketoacidosis. Ketoacidosis. Dorothy, hebu kimbia huko mbele kidogo. Some people have entered here. Faster, faster, faster. Enda. Acha nitoke. Just a minute, guys. Just a minute. Just a minute. Yes, I'm back. Now, you see, we talk about, we're talking about diabetes. Now, diabetes is, it causes something called ketoacidosis. Now, what is ketoacidosis? Ketoacidosis is a high glucose level that leads to impaired electrolytes. So if you have impaired electrolyte, it may damage your brain because it leads you to get something called encephalopathy. And encephalopathy causes brain death, brain tissue death. So hyperlipidemia. Hyperlipidemia. What is hyperlipidemia? Hyperlipidemia is high cholesterol levels in your vessels. So if there is high cholesterol levels in your vessels, what can you get? Now, that is where I really need people to understand because where is this paper? Because it is very important to illustrate so that you can know. Now, this is, I will draw something here. I will draw something here. Now, these are your veins or arteries. Blood flow. Blood flow. Now, look at this. You see, these ones are lipid deposits. You get it? Lipid deposit. And this one is a clear artery. So when this is a clear artery, the blood flow is enough. It goes to your brain and oxygen is 100%. It is received at a good amount. But when it is like this, because lipidemia means lipids, cholesterol, they thin the they thin the blood vessels. Sana, welcome to the platform. It thins the blood vessels. So what happens? The blood flow becomes, yes, Sana, welcome to the platform. Welcome. We are talking about how to manage a disease called vascular dementia. Dementia due to blood vessel damage. Now look at this. Look at this. Very important. This is very important. Now your blood vessels, have sediments of cholesterol. These are cholesterol. Now, when they flow, blood comes in, but it goes here very little. This blood that is here, that is coming so little, will not take enough oxygen to your brain. So what happens? Some of your brain cells starts to die because of deposits of cholesterol. And the other thing is your blood vessels will have something called deep venous thrombosis. Please don't distract me. Yes? No, akuje kesho jioni. You see that is that is now how hyperlipidemia, which is high cholesterol levels in your body. Let me write here cholesterol deposits. Cholesterol deposits. Sorry guys, I'm at work and people are really on my and I have to finish this. Now, you see, these are cholesterol deposits. Normal artery, this one is with cholesterol. So you see that? You see how it happens? So it reduces your oxygen levels to your brain, and your brain starts to die off. Now, smoking, nicotine. Nicotine is a dark substance that destroys, and it may make you have low absorption of vitamin B1, which is thiamine, which we have seen how it can destroy. The loss of thiamine in your brain, you see how it can destroy the brain. So you see very many factors, and now we are opening our eyes on how simple things that we think are normal in the society can lead us to get brain issues. And then someone comes up with a long-term problem, including stroke. If you get stroke, there is mild stroke, which is transient ischemic attack. Even this hyperlipidemia is the cause. Obesity is the cause. Arterial fibrillation, your heart being beating irregular and having arrhythmias. Arrhythmias is beating very faster or low. You see, we call it tachycardia or reducing in tachycardia is beating fast. Pa, 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 pa. Arrhythmias are so bad. They may make you get a stroke. Now we continue. How can we help a person like this? This person, the first thing you do, you take the blood. If you suspect vascular dementia, you find the problem. If it is hyperlipidemia, you start on statins to reduce the cholesterol. You get it? If it is other things that we have said, like diabetes, control the sugars. We are still here, but I will come up with a topic on how we will talk about diabetes. That time is coming about diabetes, because diabetes has been so rampant, and people are really suffering from diabetes. So we will come up with a topic that we will talk about diabetes, because it is coming everywhere. Every time we have talked on a topic, you see, we have talked about diabetes. So we will talk so that people will know how to control diabetes. Smoking. Smoking, I will not say we can do A, B, C, D. No, you should stop smoking. Just stop. Smoking, I will not say it's good. With alcohol, I'll tell you reduce, but with smoking, I'll tell you, my friend, my sister, my brother, my relative, my neighbor, I will tell you to reduce smoking. It's our Emancipation Day here in Jamaica. What do people do in Emancipation Day? Tell me so that I cannot be left out. What do people do in Emancipation Day? Please help me understand, please. Okay, let's continue. Let's continue. Arterial fibrillation or arrhythmias. That one we have talked about. Now, let's go to management. Now, you give some drugs like codeine stress inhibitors to help memory, like rivastigmine. There is a drug called rivastigmine which boosts memory. It helps a lot. Memantine, some used, it is used, memantine is used in dementia, some to increase some dopa. And then we have antiplatelet therapy when people has, a person have hyper hyperlipidemia, high cholesterol levels, sediments in there. You give aspirin or clopidogrel. These are things that help to thin your blood so that it can be mobile in your body, so that your brain can get oxygen. You get it? Because when it is thick with a lot of cholesterol, what happens? You will not get that oxygen in a good way. Now, we continue. Cognitive function, we have talked about. You talk to these people, you talk to them, tell them this is not good. For go to occupational therapy, we have talked about it. Behavioral therapy for emotional support to avoid depression and frustration. You see, we have talked it in the other in everywhere. In every topic we talk about it. This is the day that the slaves in Jamaica was family freed. Whoa. Yes, yes. I see. Even in Kenya, we have Independence Day. Here in Kenya, we have something called the Independence Day. I think we were independent in 1963. Very well. I wish all the people of Jamaica, my friends there from Jamaica, including my fellow friend, Jamaican uncle. There is all our friends from Anne. Last time said I did not call him. Yeah, please enjoy the day. It's a good day to you. We clap for you and say hooray. Now, we go on with speech and language therapy. Speech and language therapy is very important because when the centers of speech are destroyed, therapy is important to help regulate and retain the one you have. Lifestyle modification, regular physical exercise, good diet, mental activity, social engagement, community group, and family support is very important. Nutrition, we have talked about nutrition, fruits, whole grain, omega-3, antioxidants like vitamin C and E. Vitamin C and E are antioxidants. Please don't forget that they help your body to detoxify some things. Now, we supportive measures, caregivers, that one we have always talked about it. Caregiving, monitor blood pressure, cognitive measures, mood and behavior should be monitored. When I'm talking about support for caregivers and family, I'm talking about today is a holiday in Trinidad and Tobago also. Emancipation Day. Emancipation Day is everywhere. Hmm? I didn't know. I'm seeing it today when the slaves were freed. Wow. This is very important because these slaves are for our forefathers and we should celebrate them for our independence and the freedom we have. Please, everyone, be in spirit with the Jamaicans, Trinidad and Tobago, big up, very important. Now, I've said for support for caregivers and family, this is what is important. Educate those people around that person about the disease and its progression so that they may not be in denial. Communicate. Communication training is important on how to communicate to these people. Respite care services very important. Support groups or counseling is very important. Okay, you see, now we continue, monitor and follow up. And you see, when you are monitoring, what you should be monitoring is blood pressure, sugar levels, and cholesterol. Because cholesterol is high lipidemia, and you've seen, I've illustrated how they can destroy your body. Cognitive, mood behaviors, advanced care planning, medical wishes, legal planning, long-term options, because now there are some things that are not term. They can go up to, yes, lewy body. The third one, you remember when we were talking about dementia, there is lewy body dementia management. That is what I want to do now. It is the fourth one. Lewy bodies are proteins. It's not a big medical word. These words are just words, but they mean very simple things. Lewy body dementia. Lewy bodies are some proteins that are destroy your brain. They are seen mostly in Parkinson's disease, and when they come, someone may seem to be having hallucinations and visual hallucination, and sometimes fluctuation of cognition. Your cognitive function fluctuates. Eh? So, how can we help these people? We are always giving something to boost your brain, like to be alert, like rivastigmine. There are some drugs that help improve your cognitive functions, being alert and behavior also. You get it? The Napazil is important, but uh, for rivastigmine is FDA approved for this Lewy body dementia in Parkinson. Yes, Carol West, we are in spirit with you guys, because you see, when the flames were being released, those are our forefathers, and they fought for our independence and the freedom we have. So everyone who is here is in spirit with you, and we feel better. Now we go to, you can give something, maybe added to moderate severe cases, mematidine. They help to improve the brain. They boost the brain so that you can be well. Mematidine. Now, because this is a Lewy body dementia, there is nothing we can do. What do? We cannot open the brain to scrap off those. What do? We try and help when you see visual hallucinations. You try and help when you see this person having visual hallucinations. When you see kish, 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 kish in the platform, we are managing forms of dementia. Hello, Dr. Benjamin. My news, I saw you with the Jamaican uncle. Big up Jamaican uncle. Yes, Jamaican uncle is my personal friend, very good friend of mine. So support Jamaican uncle as you can. He's a good man, and we love him as our Jamaican uncle. Kish Kish, welcome. Let's continue to talk about how to manage this Lewy body dementia. Those people that have Parkinson's and they have this dementia. August 6 is when Jamaica became independent from College of British. August 6. Carole West says August 6 is when they were, oh, okay. So there is emancipation. I've heard a song of Bob Marley singing about Emancipation Day. I wish I had that song. I sing it. Yes. Thanks, Carole West. Thanks so much to tell me that. Now we are continuing. So if you find someone has hallucinations and is delusional, we talked about delusional. Please, people, like the video and share it, please. It makes we have more and more impressions, so that we can bring more people and help people here in this channel. I'll soon be bringing people who have these problems, and some of you will cry, because when you see these people, they need help, but they don't know how. Kish Kish tells me in Emancipation Day. Yes, Kish Kish. I know now. Thanks so much. Now, I will be bringing these people, and you will see that mental health is something that you cannot laugh about. This is a big topic, and some of you will shed tears when they hear these people talking. It's just my secretary is and the group is planning on how we will be bringing them in with a good studio, and they talk out their grievances and their lives, so that when you are there, you know how this thing is a serious issue. Yes, we continue. Now, when someone has visual hallucinations and delusions, these are positive signs of psychosis. You give antipsychotics, risperidone, haloperidol, and olanzapine. You give antipsychotics. But when someone has depression and anxiety, you don't give antipsychotics. You give mood stabilizers, or sertraline or ciprofloxacin. You get it? This will help the mood. Now we continue. Motor symptoms, like in Parkinson's, people have problems with movement because of levodopa problem in the midbrain. Hmm? So dopamine. So what do? We give cinnamate, which is a levodopa, to substitute whatever you don't have. Hmm? You get it? Now that those are things that we do. Hmm? Parkinson's disease is not treated. Oh, I see you have retracted it. It is managed. These are problems that are not treated, but we can only manage. Now, sleep disorders. What are sleep disorders? What are sleep disorders? You remember our problems with sleep disorders. In sleep disorders, we give melatonin, first line. First line is melatonin. And then clozapam, carefully. Clozapam, because it will make you relax and sleep. And then we have excessive daytime sleepiness. Please don't forget to Parkinson's. How do you manage that condition? That conditions we have talked about it, but I'll repeat. Kish. You give drugs to improve alertness and behavior, because Parkinson's is a disease that some proteins are building up in your brain that you cannot scrap out. They are called Lewy bodies, and they are destroying the frontal cortex and the limbic system of your brain. So we cannot remove that. You get it? We cannot remove that. So what do we do? What we do, we give some drugs to improve you to live normal as time goes by. Because there is nowhere we can open the brain and scrap those proteins. Lewy bodies are proteins in Parkinson's disease that grow in your brain and destroy the normal function. So we give restigamine to improve cognition, memetadine as just to improve cognition, and then we have psychic behavior. If you feel someone has visual hallucinations and delusions, what do? You give antipsychotics, because now this is a problem, a psych problem. And here, if someone has depression and anxiety, those are two different things. You give citalopram or sertraline, they improve. You get kish. We are continue. If because it in Parkinson's there is a problem with dopamine reduction, we usually give something called cinnamate. Cinnamate is a form of dopamine. It enhances that hormone called dopamine, so that what happens? It enhances dopamine so that you can you can live well. You get it? So that you can live well by that neurotransmitter. Mary Butler Britton, thank you so much. Thank you so much. If someone is not understanding, please just ask. So you see, we give that drug called dopamine. Or how do you manage the shaking? The shaking is because this person has no neurotransmitter called dopamine, which is produced between the midbrain. So we give that drug called levodopa, cinnamate. When it is at a good level, this person stops to shake. You get it? And you give vitamin B1 and B complex to help the nerves to regenerate. Because I explained, if you start from the beginning, I explained how a person shakes, even when this person has taken alcohol. When we finish this, please do what? Start the video from the beginning. Start the video from the beginning, and then you will do what? You will understand. You get it? So levodopa helps to stabilize the shaking because it is low, but when you substitute, it helps. B1 and B complex, both of them you can give, but thiamine, which is B1, is very important. Kish. Now, sleep disorders, we have talked about sleep disorders. Melatonin is important in sleep disorders. Evaluate sleep hygiene. Treat contribution. Treat contributing factors. Here, if you are stressed, you know what to do. like autonomic symptoms. Kish kish, thank you very much. Orthostatic hypotension, increased salt intake. Hypotension is low blood pressure. Constipation, if someone has constipation, you give fibers, foods with fibers, green, fluid, stool softeners, very important. Purpose, fruits is very important. Urinary symptoms, when you're going to the loo and you cannot micturate, what do? You give some drugs like anticholinergics with caution, bladder retaining. You get it. It will help the bladder not to be retaining. Now, non-pharmacological management. What do you do when it is non-pharmacological management? Cognitive stimulation, environmental modification, visual aids if you are not seeing well. Environmental modification, reduce clutter and increased light. You reduce it because it disturbs someone who has these problems. Cognitive stimulation, like you give the puzzles, the games that we usually, it helps to boost the brain. Speech therapy, very important. And then we will talk about caregiver and family. I've talked about caregiver and family support. Remember that. Always education of the disease to the family, training in managing hallucination and rigidity, emotional and respite support, access to groups with people with the Lewy bodies, very important. Monitoring is very important. Medication side effect you check, like haloperidol can bring hallucinations that very bad issues. And behavioral symptoms, very important. Cognitive status, very important. Advanced care, early discussion with power of attorney in that state of yours, feeding and care preferences, legal and financial planning is very important because this is not a disease that we will treat today. It is a disease that is for long term treatment. Now, that is Lewy body dementia, which is brought by Parkinson's. Frontotemporal dementia. We have talked about frontotemporal dementia. That is the fourth one, frontotemporal dementia. Frontal and temporal dementia. You see, frontal and temporal dementia, it depends, it just says Lewy bodies can be in the front or this side, or it can be because of boxing or trauma. You've been hit from this side and this side. So common symptoms may be apathy, hmm, disinhibition, social inappropriate behavior, because in the center of the brain is where you judge which things to do. Impulsivity, you are always impulse. If you want to take something, you don't ask, you just take. If you want to buy something, you just buy. Compulsive behavior, emotional blunting, all these are symptoms. So the drugs that are used are sertraline. hmm, these are drugs that help reduce disinhibition, compulsive, and irritability. So if someone is irritable, mostly always use citalopram. Citalopram. This one will reduce the irritability. Hmm? Tra- Trazodone. Trazodone. They are drugs with very funny names. They reduce aggression. You get it? Atypical antipsychotics like quetiapine and olanzapine, because here you may find someone is has psychotic behavior. Language variant management, help the language variants like non-fluent, semantic variants, and logetic variant. These variants are what we use as medical practitioners to find out the stage of this person. So these variants like non-fluent agreement variant, semantic variant, and logetic variant, we use them to find out the staging. You get it? Treatment strategies, speech and language therapy is very important. Communication aids are very important, like for ears, educate caregivers. Non-pharmacological support. Non-pharmacological means those that you don't give drug, the support that you don't give drug, structured routine, environmental modification, supervise and supervision and safety is very important. Behavioral intervention is very important. So people here in this mixed or frontotemporal, it is frontal and temporal. It can be because of trauma, alcohol, or even the Parkinson's, because it can attack anywhere. And remember, even Alzheimer's can be here because you can have a problem in the frontal and just a place before the midbrain, you have the Lewy body. So that one will call it frontotemporal. You get it? So that this is like mixed, and the treatment is the same like the other one that we have just come from, which is the Lewy body of dementia. It is just the same. Now we go. If you have anyone has a question, please ask, and please like the video. Like if you have not liked and subscribed, subscribe and like as we go on. We have talked about the mix, the two or more type of dementia, and then we have the one which we were talking about yesterday, very funny one, which is called Creutzfeldt-Jacob's disease. Leads to rapid mental deterioration, jerk movements, and within a year, you have gone. You see, Creutzfeldt-Jack's disease, here, remember what we talked about. It makes your brain look spongy. It makes your brain look spongy, and it's the only one which can be passed on. Let me repeat the definition. Is a rare, rapidly progressive, and fatal prion disease that causes severe degeneration. It leads to dementia, myoclonus ataxia, visual disturbance, and akinetic mutism. Mutism is you don't like talking. You're just people talks to you. You're You see now, often progressing to death within months. You get it? No cure of this disease modified treatment has ever been. So how do you treat it? Alleviate distressing neurological symptoms. You remember when we said the disease of a mad cow? Now please don't eat cows that are not certified by public health officers. You may get these problems. Now, the jerky ones, like Kish Kish was asking about how do you treat the jerky ones. Here, we have some drugs we use like clozapam and valproic acid. So the jerky ones, when you do this, sometimes people don't know when they are doing that. So if you are talking to some people, you don't know this person is the first day, and you see this person doing this, you know that is called chorea. Chorea. That person is not does not know he's doing that. It's called chorea. You give valproic acid and clozapam. Dystonia. Those people that do this, every time you're talking, this person is doing this. That is called dystonia. Dystonia, what do you do? Clozapam and valproic acid, dystonic motions. They are not aware. They are always not aware they are doing that. But some in dystonic you can be at least aware, but chorea, the jerky motion, you are not aware. So valproic acid helps to reduce the jerky ones. You can do a test called you check for meningitis by removing your CSF and checking the CSF is cerebrospinal fluid that we remove from the back at the spinal cord at the fifth level down there. So when you do it, you see protein contents, you know this is meningitis. You treat meningitis. You get it? So what do we go? We go on and give, you treat it by antibiotics if it is bacterial meningitis. If it is fungal, you do antifungals. If it is viral, there are some steps you take to treat them. So seizures, when this person has a seizure, you give levetiracetam, valproate, benzodiazepines to reduce the seizures. There are so many, phenobarbital to reduce the seizures. You see, psychosis, agitation, and anxiety, you give antipsychotics, olanzapine and benzodiazepines. You give those ones. You get it? So we continue. The other treatments are normal supportive care. I've talked about it a lot. Psychosocial support, palliative till the end of life. You get it. New bodies, please don't eat cows that you don't know where they are slaughtered, and they are not slow. When a cow dies or something in an animal dies and you just slaughter and eat, please don't. Huntington's disease, dementia, the next one, Huntington. I want us to finish these diseases. Tomorrow we have another huge topic that is coming. Huntington's disease, dementia. How do you treat Huntington's? We talked about Huntington's disease. If you have not gone through the other video, please go through it so that you can relate with this management. You'll see it is a step-by-step learning, step-by-step learning. Now, this one is a mutation. Huntington's disease is a mutation of a gene in the HTT gene. So what can we do? Nothing. We only support cognitive behavior. Hmm? We only support. Thank you so much, Carol West. I appreciate. Thank you so much. Memory decline. We help by giving some drugs that I've named in the other video. The choria that we have seen, you've seen. Hmm? Because you see, this one is a progressive inherited neurodegenerative disorder caused by CAG tricholine repeat expansion HTT gene. It results in movement disorder psychiatric symptoms. Here is where you get the real chorea that someone is not aware like this. Where did you go yesterday? I'm okay. I went to my grandmother and we talked. Have you ever talked to someone and that person does that? That is choria. So what do we do? Tetrapathine. Tetrapathine is a drug of choice we give them to reduce the involuntary jerking of of the of the your shoulders or your body specific place. Rigidity and bragnesia, physical therapy. You give physical therapy. Cyclic symptoms, we have talked about these drugs. I'm not going to repeat them, like serotonin inhibitors, fluoxetine, mood stabilizers. We have talked about them. Help these people by putting them on occupational therapy. I've said there is a difference between physiotherapy and occupational therapy. Please go back to the video and see the difference between occupational therapy and physiotherapy. So what, yes, hey, my team is Sky. Hey, welcome to we are managing dementia, and this is, we are at the Huntington's disease, which is the eighth one. The eighth one. Please like the video and share. We will get more impressions so that we can grow together. Speech and language therapy is very important. Speech and language therapy is very important. Nutritional support, very important in Huntington's disease. Find out in Huntington's disease, family and genetics. Autosomal dominant inheritance 50%. So if the family members have this problem, find out. Palliative and long-term care planning. Plan for these people, because this is something that is mutated. You cannot treat. Then it is hard to treat it. You get it? So please help these people by regular cognitive measures, attention, executive function, and memory. Monitor motor function like chorea and psychosis. And nutritional and swallowing, very important when it comes to nutrition and swallowing. Yes, we go on. Summary and key points in this, please. Cognitive functions, motor functions, psychiatric function, nutritional, and planning. Let me just a minute. I bring something. I want to check if there's something that there is the dummy that was being used is still there. Don't log out. Just a minute. Yes, I'm here, I'm here, I'm here. I'm trying finding the dummy for you guys. Just a minute. Yes, 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 I'm back. Sorry for that. I had to do that. Now, where were we? I've not found the dummy. It's still under use somewhere. Now, for Huntington disease, we have talked about a genetic. Maureen Chege, welcome. Now, at least I have one person here from Kenya and Kish Kish. Maureen Chege, welcome to the platform. This we are talking about Huntington's disease and management. And you see, these are complications of dementia. These are complications of dementia. There are 9 types of dementia, and now we are talking about Huntington's disease. Now, anything that has a mutation, it is carried out genetically. Let me draw something called the DNA. The DNA as strands of, where is this? Let me get, it's very important when you understand what genetics and genes are. The strands are like this. So these ones, things that are like this inside your DNA, are the ones that are called genes. So if there are two like this, you will count like, the light is so much, this one you are seeing it very well. You count 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. That is called an allele. Allele. So the gene comes like, let's say, T, T, E, 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 T. The gene comes out like this. These are proteins in a gene. I want everyone to understand how it comes. Now, this is an allele, one allele, and this is a protein, 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 protein. Protein, 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 protein. You get it? So if these are the proteins, how does the mutation comes? If I remove this G here and put it somewhere else, like here, and this is the normal one, that is what we call the mutation. So Huntington's disease, there is this gene called HTT that you are born with that is not at the normal side, just like the Down syndrome. Even the Down syndrome, this is what is there. Klinefelter syndrome. Klinefelter syndrome. You get it? Hmm? This is now how it is and how it is programmed. So you, when we talk about genetic problems, this is the key center. You see, it is going even here, even above here. Let's see. Here, here, these are protein, 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 protein inside your DNA. So if you cut this and you have this and this, what is that? A mutation. So that is an overview of genetic mutation in a person. You get it? That is an overview of genetic mutation in a person. So what do we learn about genetics and gene, like in Huntington dementia? It means it is something that someone is born with that is disturbing well-being or well formation of the brain. So what can we do? Nothing we can do. If someone is born with Down syndrome, there is nothing you can do other than to treat the symptoms. So we give some drugs that I've named there, and we try to help by cognitive uh, issues to help cognitive measures so that this person can have structure, memory, and aids from the caregivers to help motor function. When we talk about motor function, we are talking about the muscles. Always things about the muscles, how to walk. Psychiatry, we are talking about behavior of the mind. Nutrition, food, planning, how to this person can plan. Now we continue on monitoring. Monitoring, always check on the movement, the how this person walks, if he falls. Nutrition. If you are having a question, please, I welcome your questions. Please don't stay with your question. I welcome every question. Be it you think it is a stupid question. If it is a confidential question, my email is benjaokwesh@yahoo.com. At Yahoo. Let me pin it. Push that to that email as I will answer. There is no mail that I don't answer. Now, we continue. We have talked about Huntington's disease. You see, these are diseases that you can not treat but manage. There is the one that we are going to, the last one, which is normal high pressure hydrocephalus. When you hear about hydro, you think of water, fluid, fluid, fluid. When you think of hydro, think of fluid, fluid. So how does fluid interfere with your memory? Dementia. We talked about it, and I'll give just an overview. This is how you are born with normal cerebrospinal fluid. Cerebrospinal fluid is the fluid that covers your brain and your spinal cord so that it cannot get trauma. You get it? So that you cannot get trauma. You see, if that fluid is not there, your brain will hit in the skull, it will hit this way. If someone hits you, it is being heated, and that is not fine. So what do? God was a very clever genius, and he saw, let it be be in a fluid. Let it be suspended in a fluid so that it cannot get hit the brain. So we get that you are born with cerebrospinal fluid that is normal. You get it, but the brain is bigger, or the head is bigger. So this, they are not relating. The ratio of your brain to your cerebrospinal fluid is not relating. So what is happening here? What is happening is this. What is happening is this. Gait and movement, because you don't have balance of your brain, is destroyed. Urinary incontinence. You have urine issues. You get it. Cognitive decline. Sometimes you cannot reason well. Even planning is, you cannot reason well. Subcortical dementia. You see, you have dementia. If occurs due to accumulation of cerebrospinal fluid in the ventricles, cause ventricular megaly. Your ventricles becomes big because the cerebrospinal fluid is produced from the cells of your brain without significant increase in CSF pressure. You just you see, if it occurs, if occurs due to accumulation of CSF, cerebrospinal fluid, in the ventricles, causing ventricular megaly without significant increase in CSF pressure. Hmm? Diagnosis, we always do a brain MRI. Treatment is always surgical. Surgical insertion of a shunt to drain excess CSF so that you can balance the pressure of the brain and the CSF. You get it? Hmm? Sometimes we get a shunt, we put a pipe to the peritoneum. Peritoneum is a layer of your skin that goes there, and then we drain the effectiveness. It helps you balance. Most improve the gait, the balance, and the urinating. At times it comes clean. Ideal candidates for this, when you see symptoms are so much, this is when we do this. Eh? Risk for this is what? Meningitis. Infection can go to your brain. Risk for this surgery is that. So we sometimes treat the symptoms, um, gait instabilities, urinary incontinence, cognitive declines. Those are things that we do. I've talked about cognitive functions for long, and you even now some people here are doctors. They know the drugs for cognitive function like SSR, serotonin inhibitors, fluoxetine. Hmm? Those are those drugs that help to boost your memory. Urinary incontinence, you see medications that contract the pelvic floors. I've talked about them. Care and caregiver and patient support, very important. You prevent falls. Hmm? Home environment set of safety is very important. Emotional support, Dorothy, after, yes, okay, okay. Emotional support is very important to these people because they don't have balance. They don't have balance. So what do we do? Drainage. But there should be someone that is helping this person always. Monitor and follow up. Post shunt, minor for complication. You see, when you prick and you remove the CSF, it may bring a complication like infection to the CSF inside. So it may bring meningitis. So after that post shunt, you should block and monitor for infection. Any sign of stiff neck, report to the doctor because it may be meningitis. Reassess the gait. How is this person walking? Do always imaging like CT scans. Very important. Hmm? Very important. And then summary for management, diagnosis, first line treatment, you know it is VP shunt. First line treatment here is putting a shunt, reduce you reduce the cerebrospinal fluid. Incontinence management, behavior and pharmacological. You give some drugs to help clear urine. Cognitive functions, that one we've talked about. And that one is hydrocephalus. Those people who are born with what you always say water in the brain. It's not water, it is cerebrospinal fluid. And you see sometimes they behave like people that they forget everything every time, or psych people. Now you will know when it is high, it can cause a problem. You see, that is how we treat. Yes, that one was the last one. And we have gone through several. I know some people thought that dementia is just dementia. Now you know we have 10 types of dementia, starting from Alzheimer's disease, vascular dementia, the ones for blood vessels, we have talked about it. Lewy body dementia. Lewy body dementia, the proteins that the Lewy bodies, alpha synuclein deposits that go to your brain, we have talked about it. Frontal temporal dementia, we have talked about it. Parkinson's disease dementia, we have talked about it. Mixed one, we have talked about it. Two or more types of dementia, that is called mixed. Creutzfeldt-Jakob disease, the disease of a mad cow. A cow can give you this disease by eating the meat. We have talked about it. Huntington's disease dementia, we have talked about it. Hydrocephalus, that one we have just talked about it. But the big one that I really insisted, alcohol-related dementia. Please, Please start this video from the beginning. Help a person by listening to that. Alcohol related dementia. And we will stop drinking a lot at family gatherings and parties on weekends. Today is Emancipation Day for Jamaica. Let people drink, but not a lot because they can get this. Now, I think our time has gone and I'm supposed to be seeing other patients. Thank you, everyone that has been in the platform. But I'm giving like 5 minutes to anyone who has a question here. But if you feel if I'm when I'm continuing to talk, please ask a question. Please ask a question. But if it is a confidential question, please, my email address is there. You can just email me. This is very confidential. As a doctor, you should be professional. I'll be very confidential and I'll call you or I'll email you. I saw you with Jamaican uncle and surprise now. Thank you so much, Marlene Augustine. Marlene Augustine, thank you so much. Yes, yes, yes. I'm looking forward to be seeing you and even to discuss issues that are out of mental health that are affecting your body. Issues that are affecting your body that are out of mental health. As a doctor, we don't just treat. We sometimes give healthy information that can help you to live well, to live well. Good, good, good. Very nice and well. So we if you want to understand most of my topics, when you have time, you you go through these topics from mental health overview. You will understand why these topics are coming here like this. And some people think mental health is just when you see a person is a mad person, or we call them mad people, you think that person has a mental issue. No. All the issues that we have discussed and talked about slowly by slowly, you will notice that you may feel you are okay, but really you are suffering mentally. If you go through every topic, like sleep-wake disorders, we went to personalities, where personalities disorder, those people that call themselves I am an introvert. We talked about them. We went up to sexual disorders, and we saw sexual disorder is a very broad topic. Please go up to there and learn when you have time. Learn so that you can help our society. So if we don't have any question, I think I will log up now. My email address is there. If you think there is a topic you really need me to talk about that is even out of mental health issues, if it is a issue concerning diabetes, hypertension, or a disease that you cannot understand, please just write an email and tell me, I want you to talk about this disease. May it be confidential that I'm not the one who posted it. I'll do it like you say. You get it? I will talk about the topic and exclude you from the topic, your name. You get it? Medical issues are confidential, and if someone has not come out to say, I want, it is important. Oh, yes, hypertension. Yes, I'll talk about it. Very many people have asked about hypertension. I will definitely talk about it. People, those that came in late, please, you will start it from the top, and others that you have not gone through. Have a nice day. Ida Jack, as we go on, Ida Jack. If you have not subscribed, please subscribe. Have a nice day and be blessed, everyone. See you tomorrow at the same time. God bless everyone. Thank you so much. Bye.